Hey friends, welcome to the YouTube channel Health Q, the place where our mission is to motivate you to look at the brighter side of the health. As you know, we release videos every Monday, Wednesday and Friday related to different health topics. It ranges from neurological rehabilitation and information. It ranges from information related to your musculoskeletal health, or else you can say muscles and joint related health, and even we cover topics related to kids' health prevention. So there's a lot of content that is already there on our channel and we would be uploading it more frequently. So make sure to subscribe to our channel. Now, coming to today's video, since this is Wednesday and we are going to talk about musculoskeletal disorder, today I would be sharing some of the common injuries that is more prevalent or else you are more prone to develop if you are a dancer. Watching someone dance is a delight, especially someone who is professionally dancing. It's just absolutely fun to watch them. Although dance looks simple and effortless, but it's not easy for dancers. There's a lot of injuries that comes on the way in the journey of a dancer's life. Now, there are certain typical or else say very common injuries that a dancer is more prone to develop compared to a sedentary person. So if you are a dancer or is planning to get indulged into some dancing based activity, make sure to watch this video. So, as I said, dancing involves or else comes with the risk of injury. This is because there is a continuous stress that's falling on your legs, knee, etc. There's this combination of hand and leg movement that's constantly happening, which requires the muscles to put a lot of effort. And that's why muscles and bones are more prone to develop injuries. Now, coming to the common types of injuries that's seen among dancers, these are number 1, hip injuries. Number 2, snapping hip. Number 3, foot and ankle related injuries. Number 4, knee injuries. Number 5, stress fracture. Number 6, arthritic changes on the joints. Now let's talk a little bit more deeper or else in detail about these injuries. So let's start with the first kind of injuries, that is hip injury. Hip injuries is more commonly seen among dancers compared to any other professionals. The reason being the more involvement of hip-based movements. Snapping hip syndrome, hip impingement syndrome, labral tears, flexor tendinitis, bursitis, sacroiliac joint dysfunctions are some of the common problems that develops in a dancer related to hip joint. Snapping hip means that snapping sensation is felt when a dancer tries to flex or else bend the knee front and back. This is always accompanied by a popping sound. So a dancer will always experience a snapping and popping sound around the hip region. The cause is just because of overuse or else tightness of IT band muscle, the muscle that lies on the side thigh region, weak hip muscles, and sometimes due to poor foot mechanics. Other condition related to hip joint injury like hip impingement is something where the muscles that surround the hip joint gets impinged or else pinched while performance of hip movement, especially the forward bending movement and backward bending movement. Labral tears are nothing but the tear of the structure that surrounds the hip joint. The labra works as a supportive structure that holds the hip joint on its place. And many times this gets torn following repeated activity and injury. Hip flexor tendinitis is nothing but tendinitis of the hip flexor group of muscle that lies on the inguinal or else front thigh region. This group of muscles gets inflamed, leading to experience of hip pain. Hip bursitis is nothing but the hip inflammation of hip bursa. Now, hip bursa is a structure that surrounds the hip joint and helps as a shock absorbing structure and usually gets inflamed, leading to experience of pain. And sacroiliac joint dysfunction is nothing but an inflammation that happens at the junction of sacrum and iliac bone. Sacrum is a tailbone and iliac bone is a pelvic bone. These two bones joint and that joint particularly is called as SI joint, and this commonly gets inflamed, leading to experience of pain. The next common area of injury is foot and ankle related injuries, and especially among that plantar fasciitis, Achilles tendinitis, trigger toe and ankle impingement are common conditions that is seen among dancers. Achilles tendinitis is nothing but inflammation of Achilles tendon. Achilles tendon and tendon tendon that forms or else attaches your calf muscle to the heel bone. Trigger toe is nothing but an inflamed band-like structure that's formed in the toe region, which is very painful, requires cessation of dancing for some time. Even ankle impingement is very commonly seen among the dancers. Moving to the next area that's more prone to develop injury is knee joint. Patellofemoral pain syndrome, also called as chondromalacia patelli, where there is pain in the front knee region, is commonly seen among the dancers. The reason being, again, tight quadriceps or else your front thigh muscles, tight iliotibial band muscles, and sometimes due to malalignment of the knee joint bone, or else you can say kneecap bone, in relation to the knee joint. This altered mechanics leads to experience of this pain. The next kind of injuries is stress fracture. Although the dancers don't have much high prevalence of fall, but there is much high prevalence of fracture due to repeated stress that falls on the joints and bones, especially the foot bones, especially the tarsals or else the toe bones, tibia bone or else say shin bone, and sesamoid bone, which is also a bone that lies on the foot, is more prone to get fractured following dancing activity. This doesn't mean that every dancer will develop this kind of stress fracture, but yes, these bones have to take more stress, and that's why they are more prone to develop fractures. Lastly, arthritic changes are also common, especially in the hip, knee and ankle region among the dancers. Reason being, again, a constant and repetitive weight bearing happening on this joint. So now, once you have identified or else you are knowing that what kind of injuries are common in you as dancer, how you can prevent it. Although certain injuries cannot be prevented, it just happens in a fraction of seconds despite you being taking care as much as possible. But on your end, there are certain things that you can do in order to reduce the severity of the injury, in order to reduce the prevalence of the injury, and even sometimes preventing certain arthritic changes or else long-term damage that happens to the joint. So what are these preventive steps? Step number 1 is eat and proper nutritious food. Proper nutrition helps to maintain a good muscle strength, muscle girth, and at the same time a good muscle flexibility. Nutrition also helps in maintaining a good bone mineral density. Staying hydrated is also a very important aspect so that you can prevent fall or else dehydration related symptoms that makes you more prone to develop injuries secondarily. Second tip is take adequate rest in between your rehearsals, and at same time make sure you also take adequate rest before you have some major performances. This helps your muscles to rest and also helps to maintain a good joint strength and flexibility. The third tip: do cross training and endurance training so that your muscles and joints are well trained enough in order to indulge into a very high stress or else say high intensity activity. Always warm up before your training or else performances, and make sure you lead a healthy lifestyle that incorporates proper nutrition, proper exercises and proper sleep to ensure that your body is in a wellness state. So friends, these were some of the tips that cannot prevent your injury but to an extent helps you to reduce the severity of the injury and also prevent certain fall and damage that you can land up because of some poor nutrition issues or else poor health issues. I hope you found this information helpful. If yes, make sure to like this video, share it with your friends and family members, and don't forget to subscribe. See you next time. Bye bye.